My name is Eloise Reese-Burns. I work at Cottonwood Healthcare. I've been in this union, whether it was NUHW or Local 250 or now NUHW, for 41 years. I'm glad to serve, and I'm an executive board member. We're here this morning to welcome over 200 leaders from all over California. This is our second annual leadership conference.
All right, welcome. Have a good time today. Everybody want to be like us.
You know, politics is important to all workers in this country, but it's fundamentally important to us because government regulates and funds health care.
I want to thank you very much for leading the way, for your vision, and for staying the course, and for really continuing to remind us all why it's important to organize.
To have during this period a union, a democratic union, that firmly and strongly represents the rights and interests of working people going against the tide is very exciting, it's very critical, it's very important, and it's just great to see this conference increase in size from year to year, and I could not be prouder to have your endorsement.
In 2005, when we were on strike for what turned out to be 2 months, Nancy Pelosi's office was in our bargaining sessions, listening to what was going on. It helped us put pressure on Sutter Health to give us to agree to a fair contract. When we stand together and we reach out to our representatives, we win at the bargaining table.
Workplace organization is fundamental to winning good contracts and then making sure that they're honored.
Our DA and our assistant manager never worked for Kaiser before and never worked with unions. So let's just say they thought they were running a dictatorship for a while. We decided that enough was enough, so 7 new members became stewards. So, so the majority of the members were stewards. So I think that just showed management that we are united, and we reinforced to management that this isn't really just about our rights as union members, but also ensuring patients' safety, patients' rights, and patients' insurability for quality of care.
Now, we have a saying in our union, as we've experienced this change in the system, and that is that an NUHW healthcare worker is the last line of defense between that employer making decisions based on the bottom line as opposed to providing adequate care.
As a former healthcare provider, I am in lockstep with you and your fight against Kaiser. Because when I ran on healthcare issues and wanting a healthier Sonoma County, I didn't expect that I would become a poster child for suicide prevention or mental health parity. I cared passionately about mental health. But what I didn't know was that on January 18th, 2011, when I came home from a board meeting, my husband had tragically taken his life. This was not a choice. It was a tragic outcome of his health care provider, Kaiser, to provide adequate treatment. And that has got to stop.
You can ask any mental health provider in Kaiser over the last decade or more, and they will tell you that the next appointment is always at least a month to 2 months away.
You've been the whistleblowers, you've been the ones that say, boy, I can't see you for another 2 weeks because I have too many patients, because Kaiser doesn't want to hire behavioral health specialists because they got to maintain that $1.6 billion of profit, right?
Through NUHW, we were able to produce this white paper that we called Care Delayed, Care Denied.
Without NUHW's research to acquire, organize, develop, and validate the allegations of members that eventually became the smoking gun for regulators, our contract campaign would not be where it is today, nor would patients be any closer to getting the care they rightfully deserve and pay for. The research team very effectively organized all these separate voices into a piercing alarm that would not be ignored.
Your voice is needed more than ever. Staying together, staying strong, saying shame, shame, shame on you. Mental health parity is the law. We will provide services. We will take care of our patients, and you will pay for it. We are not done with Kaiser yet.
Let's hear it. A leader like you are leaders in mental health care.
We've had quite a successful year, organized more healthcare workers than any other union in the country. 1,548 new members so far this year alone.
We are working with over 3,000 workers across the state who are organizing their union with NUHW. What they share with all of you is that they are strong and that they are resolute in their understanding that it's only by joining together with their coworkers. That's the only way that they're going to be able to make improvements for their families inside and outside the hospital.
6 months ago, 280 of my fellow service workers voted by a 2-to-1 margin to join NUHW. And about 2 weeks ago, we have 80 technical workers who filed for an election so they can join us at the bargaining table. They think they can get away with paying us less because they are the largest private employer in Eureka, and we are isolated geographically. But since we've joined NUHW, we're going to stick together, we're supporting each other. We feel like we're no longer alone against a wealthy corporate health system.
And Providence found out that I was one of the lowest paid under their base salary. Oh boy, I got so happy when I was calling to the office. I was expecting at least $2 to $3. I was making $11.93 by then. And then they increased my salary up to $12. I feel so ashamed and I feel so abused. And I think this is why everybody is here to organize a union in our workplace.
We had a huge informational picket, and now, and a few weeks ago, we already got 98% to strike. Right now, and we are going to be ready to win again.
Long live the healthcare workers. Long live the NUHW.